Sitting in front of a computer causes neck stiffness. Changing positions and height doesn't seem to help much. Slowly losing enthusiasm for work. If we consider the achievement made possible by the invention of a computer, it's simply astonishing. Since the creation of computer, our civilization has evolved in a breakdown speed. But long-term use of a computer has led into few related diseases. Video Display Terminal Syndrome, or VDT Syndrome, is the topic for today's Oriental Medical Digest. VDT syndrome stands for Visual Display Terminal Syndrome, which is an illness caused by the computer monitor. Detrimental electromagnetic waves emitted from the monitor can be severe enough to turn some people aspermatic. Frequently, accompanying symptom is shoulder tenderness from prolonged keyboard typing. Other symptoms include low back pain, fatigue eyes, and psychological stress. VDT syndrome is very likely to be triggered by improper posture. Uncomfortable sitting and working long time without a recess puts heavy burden on the body. Carrying heavy luggage and external stimulus are other possible factors.
VDT syndrome is not a life-threatening disease by any means. But in severe cases, a patient is unable to work and other daily activities are also hindered. VDT syndrome patients usually complain of pain for more than a week and at least once a month. Occasional visual trouble may also occur.
Most important aspect of the diagnosis is patient's subjective symptoms. Initial sign is a numbness of the wrist turning into pain and progresses into a stage where the patient cannot bend enough for the chin to touch the chest. Eventually, neck rotation has a limited range of movement. Palpation of the muscle to check the status is a choice of diagnosis in Oriental medicine. As the patient sits comfortably with the head support provided to relax the muscle, then the tender area is palpated. Comparing abduction height of both arms helps to determine which muscle is affected. Patients may feel extreme pain in few points as the doctor engages in palpation. These are the pressure points. One of the ways to treat VDT syndrome is an acupuncture treatment. Invisible energy known as qi or life force flows within the meridian. When the flow of qi is obstructed, an acupuncture needle is inserted to invigorate the circulation of qi. Disposable needles are used for the safety and sterility.
The patient has a lot of tension on the shoulder from long hours of computer use. The muscle is heavily tightened along the meridian from excess shoulder tension. Patients may feel extreme pain in certain points. These are the acupuncture points.
Invisible energy flows through the meridian in the body. In case of shoulder muscle tenderness, inserting acupuncture needles on the meridian connecting with the shoulder can alleviate the pain.
Pressure points are primarily selected for the needle insertion. Other points are inserted around the hand, wrist, arm, etc. These aren't the pressure points, but very effective, since these are connected to the meridians passing through the shoulder.
When the pain is located around the neck, upper back, and the shoulder region, cupping therapy can yield excellent results. Cupping is applied to remove the stagnation and promotes the circulation of blood by creating a vacuum state. People with stagnation are likely to have a scar mark, unlikely healthy people. But this is a normal reaction and the scar will fade away gradually.
음압을 적용시켜서
Cupping removes the toxins and waste matters accumulated in the area.
신진대사를 촉진시키고
It relieves pain and promotes metabolism through the gaseous exchange, mediated by the negative pressure.
계속하면 됩니까? 이
Cupping can be done without
현재
inserting a needle, or applied after inserting a needle to withdraw the stagnated blood.
피를 뽑아내는 습식부항이 있습니다. 지금 요 경우에는 근식부항입니다.
If your work is related to heavy computer usage, then you are likely to have VDT syndrome to a certain extent. Best possible way to relieve the symptoms is to engage in a daily exercise. Sports such as jogging, bicycling, aerobics, swimming, and etc. can stimulate the meridians running through the neck, thereby reducing the chance of neck stiffness. Let's inquire about some other means of treatment.
목의 경추 부분에
Next is a muscle correction therapy. This can soften the muscle around the neck. Straighten the finger and grab back of the neck and slowly pull the fingers forward to relax tightened muscles. Depending on the habitual muscle usage, there is a way to balance deviated muscles. This patient has much more tightness on the right side, so slowly turn the neck for correction. Patient must be in very relaxed state and let the therapist do the work.
쭉 빼시고 힘을 숨을 들이쉬고 내쉬고.
One of the methods that can be done at home is called under-shower stretch exercise. Sit under the hot shower water and crisscross the fingers. Move the head back and forth using the weight of the arm to stretch the posterior neck muscles.
작업을 하는 시간은
Stay about half a meter away from the monitor and level the monitor with the upper border of the visual field. The body feels most comfortable when the arm makes about a 90-degree angle with the keyboard.
타이머 같은 거를 놓고
Try to sit upright, and a chair with an armrest is recommended.
할 수도 있습니다.
Take a 10-minute break after 50 minutes of work and have the light intensity between 500 and 600 lux.
하다고 봅니다.
Your body needs proper rest and sleep to maintain a healthy life. Regardless of how busy your schedule is, it is extremely important to take a good rest to reduce the burden on your body and mind. If engaging in a sports activity is too difficult, how about spending a lazy day with relaxing music? Thank you for joining us today. I'll see you again next time.